Hi, this is Susie Jacobson. I'm here with my husband, Dr. Mike Jacobson, CHM's medical director. We're here for the next situation report for April 7th, 2020.
All right. This is our first and probably our only sit rep for this week, so it's going to take a little bit longer, but I think there's going to be some very interesting things to you. So with that, let's head right into it. I'm going to share the screen. So we're at the World Health Organization Coronavirus Situation Reports or Sit Reps page. The one that I found the most interesting in the last week was from April 2nd. It was Sit Rep number 73. There were two things about that situational report that I found interesting. One was talking about the understanding of the transmission. It emphasized three things: that most of the transmission is by respiratory droplets, direct contact with infected persons, and then a few people perhaps getting infected by coming in contact with contaminated objects and surfaces. We're going to come back to that whole respiratory droplets aspect here in a few minutes. It also talked about that the virus was mostly shed from the nose and throat, what is known as the upper respiratory tract, and that people are probably most contagious right around the time that they develop symptoms, either a day or two before they actually know that they're sick, or the first couple of days after they begin to develop symptoms. And so the most infectious period of time for an individual is right at that window of time, a couple of days before or a couple of days after they develop symptoms. So be aware of that. So the second thing that this report warned about was that there are a growing number of falsified medical products that claim to prevent, detect, treat, or cure COVID-19. So be careful about that, and they actually have a link to where you can read about falsified reports. When it comes to understanding what treatments are approved or what test kits are approved, I go right to the Food and Drug Administration's webpage, where it has frequently asked questions on diagnostic testing, for example. And as of today, April 7th, if you go down here and you ask the question, are there any tests that I can purchase to test myself at home for COVID-19? The answer is no. They have not approved any. And so if someone comes to you and is marketing something like that, I would not purchase it. It is not approved by the FDA. It could be fraudulent. On the other hand, there are a number of companies that have received emergency use authorizations in order to market and promote their testing through laboratories. And they have a listing of those and the laboratories that have been approved for those tests. And those are increasing day by day. So with that, let's move to the statistics. Looking first globally, over 1.4 million cases identified on the worldometers.info page that I look at. Over 81,000 deaths. And then if we look at the table, this is where I spend most of my time on this page. Do you see the United States leading by far with the most cases nationally? And then sorting the table according to the number of new cases in the last 24 hours. Again, the US leads the way, followed by France, Germany, Spain, Turkey, and the UK, and then Italy. If you've been following these sit reps, I have been pointing to Italy because Italy is said to be what the US can expect to happen here about 2 weeks after they go through it. And if we scroll down to their daily new cases table, what you see is that peak at March 21st has still held now for 2 weeks, and that it appears that their new case rate, although still relatively high, is slowly coming down. It's flattened out for sure, and it is now coming down. So that's encouraging. Another thing that I wanted to look at on this international table is Japan, because I've heard rumors that Japan might be getting a second wave. So I wondered about that. And so I scroll down here to Japan. They have not reported the number of new cases for the last 24 hours yet. But I go to their page, and they've had 3,900 cases confirmed, 92 deaths. And then down here at the daily new cases rate, look at this. They had relatively low numbers of cases through February. Their first case was back when the Diamond Princess docked, and they had a bunch of new cases, but they stayed flat. They stayed flat for over a month. And then they started to emerge with a growing number of new cases diagnosed, peaking just a few days ago. And so there is concern for what's going on in Japan, and I don't really understand exactly why that is right now. If we go back to the table and look at the United States, and we scroll down, we see that as far as the new cases, New York leading the way with almost 7,000 new cases in the last 24 hours, followed by New Jersey, the state up north of Ohio, Georgia, Pennsylvania, Louisiana, Massachusetts, and so on. So that's why there is so much concern with respect to New York. 139,000 cases out of America's total of around 400,000. If I look at the state locality for Ohio, here's their table. I plugged in these numbers into the graph that I've been building over the last couple of weeks. Ohio got 332 new cases in the last 24 hours. Because of the low testing rate in Ohio, I don't pay too much attention to that blue line. It's really deceptive. We have far more cases than that in Ohio. We just have, according to our state leadership, not been able to test very many people because of the lack of test kits availability of the reagents that we need. They've been diverted to other places in the country that are far worse off. We have had 140 new admissions to the hospital in the last 24 hours. That is the yellow line, so that's going up. And then we've had of those, 417 cases in the ICU. That's a 31% rate. That's actually very good. And then we've had 167 deaths total with 25 in the last 24 hours. That's our most. And so this is the death toll in Ohio. Now, let's go on to some clinical and guidance and news information. So this article might be of interest to those of you in the health professions, particularly doctors and nurses. It's the first study published in peer-reviewed literature on the clinical course and risk factors for mortality of adult patients with COVID-19, published using cases in Wuhan, China. And so if you're interested in some scientific literature, this might be a really good article to read. And then I've also wanted to point out some other resources of which even I was not really aware or had never really studied before this pandemic. The World Health Organization has a webpage on the influenza where it tracks influenza cases across the globe every year, and it gives reports on those. Here at the CDC, the Centers for Disease Control and Prevention, there's also the weekly U.S. influenza surveillance report. It's called the Flu View. And every week is plotted on a graph. You can see the density of cases across the map of the United States. And then here's a chart that shows the number of new cases each week throughout this flu season. Yellow is influenza type A, which is the most virulent, and then green is influenza type B. So you can see that we've peaked and we're really coming down here as the COVID-19 cases are actually going up. But that is a resource available to the general public every flu season, not just during this pandemic. I wanted to point out, back at the World Health Organization, they have a pandemic phase descriptions. They have classified the normal course of a pandemic through 6 phases, phase 1, 2, 3, 4, 5, 6. And then there's a post-peak period and a post-pandemic period. So in phase 1, when the World Health Organization is first alerted, they are given a report, probably from the veterinary medicine field and laboratories, that a new virus has been detected in animals, but it's not been known to be an infection in humans. In phase 2, it's when that new virus has been found to jump to humans in one way or another. And then in phase 3, it's when that that virus has now been demonstrated to pass from humans to humans. And then phase 4 is when that new virus has been shown to cause a local community outbreak of illnesses confined to that community. Phase 5 is when that new virus reveals itself in sustained community outbreaks in 2 or more countries in a particular region, say like this one did in China and Japan and South Korea. And then phase 6 is when that becomes a true pandemic, and when the virus is demonstrated to be in sustained community outbreaks in more than 2 regions of the globe. Interestingly, phase 6, where it was demonstrated in at least 2 regions of the globe, occurred on February 1st for COVID-19. But for some reason, the World Health Organization did not even seem to follow its own phasing descriptions and did not report this as a pandemic until I believe it was like March 11th. Another question that people ask is, how contagious is COVID-19 compared to other diseases? And there's an interesting chart here that I found on Radio Free Europe, which shows that Ebola is less contagious than influenza, is less contagious than COVID-19. SARS is actually more contagious than COVID-19, as well as HIV, mumps, smallpox, polio, and measles. What the chart shows graphically is that whereas what's called the basic reproduction number or rate, or the R0, R0 to the suffix or superscription, either one, I've seen it both ways, means that one infected individual will infect at least 1.5 to 2.5 other people. That's the Ebola R0, or basic reproduction number or rate. Influenza is one person will typically infect 2 to 3 others for an R0 of 2.5. COVID-19 is slightly more transmissible. It infects between 2 and 3.25 other people. SARS, which was the first coronavirus of which we came in contact in 2003, had an ability to infect up to 5 other people. But you look up here at polio and measles. Measles has an R0 of 12 to 18. So somewhere around 15 people will tend to be infected by one person with measles. Why is that? It's because measles is transmitted through aerosolizing the microorganism. In other words, the virus is so small and carried about with almost like air. And so it hangs around in the air for prolonged periods of time. And you could walk down the street maybe quite some distance from somebody who was infected with measles, and the virus could land on your mucous membranes in your nose or mouth or eyes and be inhaled. And you could get the measles that way, that easily. Whereas Ebola, and actually COVID-19 is much more like Ebola, it's transmitted through respiratory droplets. So that requires typically coughing and sneezing in order for those respiratory droplets to be exhaled. and they will typically travel up to a maximum of 6 feet. And that's why we have been told by experts to keep at least 6 feet of distance between us and other people in order to avoid the spread of this disease. Those respiratory droplets can also land on especially hard surfaces like steel or metal and plastic, and exist and survive depending on the ambient conditions, perhaps even several hours. Some people say up to a day or two. And then if you touch those surfaces and then you touch your nose or mouth or eyes, you could potentially, at least theoretically, infect yourself with them. And that's why there are also precautions given for keeping surfaces like that sanitized and clean. One other website that I want to point you to that emphasizes the importance of good hygiene and sound hand washing practices is awesomesciencetv.com. Awesome, SCITV.com. They are a typical subscription service that we as homeschoolers subscribe to, but they've posted a video there online that is made available for free because of the current pandemic to help people to be aware of the importance of following the guidelines of healthy, sound hand washing practices. And this video graphically depicts by using fluorescence and night lights, UV light, what happens when we don't wash our hands well and how we can touch things and contaminate things and then perhaps get infected. I highly recommend it. Many of you homeschool your children. Many of you are now forced to homeschool your children because they're not allowed to go to school. I encourage you to take advantage of this very helpful service. And then the last thing I want to show you is a website that's called covid19.healthdata.org. It's COVID-19 projections assuming full social distancing through May 2020. And it's the hospital resource use page. It shows us whether or not we are going to run out of hospital beds, and particularly ICU beds and ventilators. And it shows you graphically why there is concern at the federal level that we will not have enough hospital beds or ICU beds or ventilators, and why we are working so hard to support different areas of the country so that we don't exceed our capacity. You've heard about flattening the curve. This is why it's so important. If we go to the hardest hit state, New York State, and we pull it up, here's what we see. New York is projected to hit its peak resource need tomorrow, April 8th. It is projected to need over 25,000 beds, and it currently has only 13,000 beds available. So it's projected to need 12,000 beds. And it was projected to exceed its capacity of beds back on March 30th, last week. To my knowledge, from all of the reports I've read, it did not exceed that capacity. And so I believe that there have been tremendous measures to flatten this curve, as well as additional beds brought in by the Army Corps of Engineers, building a hospital in less than 10 days there, by the Department of Defense coming in and helping, and then also by nonprofit groups like Samaritan's Purse that has built a hospital, a temporary facility in Central Park. And so New York has been working to respond, and many other states have been stepping in to help, as well as FEMA and the federal government. But if this curve had held true, back last week, New York would have exceeded its number of hospital beds and come dangerously close to exceeding their number of ICU beds and ventilators. But as far as we know, that has not taken place. Let me show you a good news slide from the state of Ohio, my home state. We have been projected to need less than 1,400 beds. We have over 14,000 beds available. There are no beds forecasted to be short. and we are forecasted to have adequate numbers of ICU beds and to need up to 223 ventilators for COVID-19. This horizontal line is our bed capacity. Here is our curve. We are not expected to exceed our bed count need at all during this pandemic. And I believe that is a tremendous tribute to Governor DeWine's orders proactively issued early in March, along with the director of the Ohio Department of Health, Dr. Acton, and Ohioans who have really come together and complied with this social distancing, stay-at-home orders, and so on to flatten that curve out and keep us well below this line. Now, from what we are told, Ohio, like other states, are not going to peak for at least a week or two. So I think that these estimates, these curves, need to be updated, and they are probably a little bit too optimistic in some cases. But with that said, it just reinforces the need for all of us to work together in order to flatten that curve as much as possible and not overwhelm our healthcare resources.
All right. Well, thank you so much. That was jam-packed with information.
Lots of information.
Yeah. And thank you for taking time out to check in with us for this update. And if you'd like to maybe close us with a word of prayer, I'm sure everyone would really appreciate that.
Yep, let's do that. All right, dear Father in heaven, I just thank you so much for your faithfulness. I thank you for our leadership. I thank you for our government. Paul wrote in Romans 13 that our leaders, our government leaders, are there as ministers of good to reward good and to punish evil, and that they are instruments instituted by you way back early in the history of man. And I thank you for them. I pray that you would give us wisdom and understanding heart, that we would listen to those who are trying to protect us, that we would be mindful of their instructions, and that we would come together as a people and be obedient and honor and pray for them and pray for our healthcare professionals and other leaders and those who are on the front lines, taking care of our sickest and watching out for us. I pray that you would help us to be prudent, to do everything that we can to help one another, to love one another, and to put others before ourselves. And I pray that you would watch over our land. I pray most of all that you would turn the hearts of many people during this time of concern to you, because you alone are our rock and our fortress and our safe deliverer. I remember, as I've quoted before, Corrie ten Boom, who said, "I know not what the future holds, but I know who holds the future." I pray that you would turn all of our hearts to you and trusting in you. We thank you that you have done everything necessary for our salvation in the person of Christ, and that you who gave us his own Son will not freely with him give us all things that we need. And I ask all of these things in the name of Jesus. Amen. Thank you, and God bless you.